Good.
Okay.
Hello, my name is Melanie Overton. I'm a registered nurse. I've been a registered nurse for 24 years, and today I'll be doing a presentation on TED stockings. We'll be going over what they are, how we use them, why we use them, how to properly measure to make sure that they are right on the patient, and the teaching that you need to do to the patient about the TED stockings. First, TED stocking stands for thromboembolic deterrent stockings, which just simply means that they help prevent blood clots. When a patient comes into the hospital, especially if they're a post-op patient, they don't get up and move a lot. Their activity is not as it should be. So when that happens, the blood can pool in the veins and they can form clots. And when the clots form, they can travel. And when they travel, they become a pulmonary embolism, a PE, which can be dangerous to the patient. So we try to not do that. There's a couple things that you need to know about this. For one, you need a doctor's order. The doctor will order whether he wants knee-high or thigh-high stockings. The next thing you need to do is you need to measure the patient. There's a chart on the back of the package which will tell you what they measure, if they measure within a certain range, as to what size you would get. There, like I said, there's knee length and thigh length. The knee length, you're going to measure from the knee down to the ankle, and you're also going to measure around the calf. When it's the thigh length, you're going to measure from the gluteal fold down to the ankle and around your thigh. And according to how they measure, it's as to what size that you would get. Then you're going to put these on your patient. It's sort of like putting on hose, like you would put on hose a female patient, a woman. What you want to make sure of when you do it, this is the thigh length, and this is, if I can get it open, this is the knee length. So you can see the difference. Of course, one's a lot longer. The thigh length, as you can see, has this little area. And this little area is what's going to be on the inside of the thigh. It doesn't really matter if it's left or right. They're interchangeable, so you don't have to worry about that. The thing that you do need to worry about is you want the smooth side against the patient. You don't want, if you can see, the stitching. You don't want that against the patient. That can rub the patient. It can cause an abrasion, an ulcer, and just an irritation to the skin. So you want to make sure that the smooth side is always against the patient. You start at the toe, you put them on, and you just pull them up like you would pantyhose. They're a little bit snug, and they're supposed to be, so they're not going to be like easy to get on, but they shouldn't be too tight. If you do your measurements properly, you won't have that issue. So the teaching that you need to do with a patient, a biggie that I think is don't walk unless you have something on over these. These are very slippery. They're very slick. If they get on the floor, they're going to fall. So make sure that even if a patient has these on, they have house slippers on, or I know that at our hospital they have the sort of like the little socks with the tread on the bottom. Make sure they have those on before they get up and walk, or they can't fall. You want to absolutely make sure that the patient takes these off about 30 minutes a day, no more than 30 minutes a day. You want to assess the patient's legs. Make sure there's no redness, no rash, no ulcers forming, no abrasions, nothing like that. You want to make sure that the patient or you wash the patient's legs, and then you want to put them back on, especially whenever they're not doing their regular activity. When the patient goes home, you want to tell them they are to continue wearing these until they resume their normal activity. At home, they're to do the same thing. They're to take them off for about 30 minutes a day, inspect the skin, make sure that there's no redness, swelling, abrasions, anything like that. And they are to be washed every 2 to 3 days. They need to wash them. When you wash them, you can hand wash them. You can put them in the washing machine, but you don't use bleach. And they're just to continue doing that until their activity is resumed. Like I said, these are used a lot on post-op patients. that not even necessarily have to be post-op patient. Any patient that comes into the hospital that's at a risk for blood clots should be wearing these. And hopefully that will help prevent any incident of, and last but not least, my great tape measure. Make sure that you have the tape measure. Don't guess. When you're measuring the patient, don't say, well, I think the calf is 8 inches. Don't guess. You know, you have to do this accurately. So make sure that you have a tape measure whenever you're measuring the patient. And the patient may change. You know, if the stockings start feeling too tight, tell them to be sure to let you know, because you may need to remeasure the patient. They may need a different size. Or tell the patient try not to let them roll. If you do, it'll form that elastic band that can cut off circulation. And you definitely don't want that to happen. So hopefully this will help you know how to measure and take care of your patient, apply the TED stockings, and what they're used for. Thank you very much.